Hello, a very good afternoon, all of you. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be doing really good. So, today we are talking about a skin condition which draws everyone's attention even when there is a tiny spot. Yes, we are talking about vitiligo. Now, vitiligo manifests as depigmented patches with a convex border without signs of inflammation with normal skin around, and they are milky white in color, well demarcated with either round, oval, or linear in shape. So we are going to have an important chat about them and how we can stop them from spreading by taking action early. Vitiligo is a long-term skin condition that causes patches of skin to lose their pigment or color. This happens because the pigment producing cells in the skin, called melanocytes, are either destroyed or stops functioning. But don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We will look at how to stop vitiligo from happening and talk about the latest treatment options. So let's connect today with our skin expert, Dr. Vignesh Narayan R, who is MD, DNB, Fellow in Dermatosurgery, Bangalore Medical College and Research Institute, MBBS, JIPMER, Puducherry, MD, Dermatology, Venereology and Leprology, PGIMER, Chandigarh, DNB, Dermatology, Venereology and Leprology, PGIMER, Chandigarh, ex-senior resident MS Ramaiah, Medical College, Bangalore, and qualified as BCBR from in Bangalore 2023. Dr. Vignesh Narayan R is a highly experienced professional with a distinguished background in dermatology with extensive expertise in clinical dermatology. He brings a wealth of knowledge to his practice. Throughout his career, Dr. Vignesh has contributed significantly to the field of dermatology. His commitment to advancing the understanding and treatment of various skin conditions is evident in his extensive body of work. And today, he is joining us from Bangalore and we'll talk about vitiligo myths and facts. A very warm welcome to you, Dr. Vignesh.
Thank you so much, ma'am. It's a wonderful thing to be on this useful program here. Hope to connect with many people and demystify the myths and get the facts straight about it.
Absolutely. We are really looking forward to this session because, vitiligo, more than a skin condition, it's also a kind of stigma, and the amount of stress or into the depression that patients normally goes in with vitiligo, it's something that we need to talk about. So today we all are here for that, and it's a privilege to have you with us for that. And to start with, doctor, because we are going to have this session on vitiligo, first of all, we would like to understand what is vitiligo.
See, basically, the skin is having something called melanin. So, melanin is a pigment, and this pigment is meant to protect us from radiation. So, this melanin is produced by cells called melanocytes. So, these cells are present in the skin. So, what happens in vitiligo is that your own body starts to go and attack these melanocytes or pigment producing cells. So, because of this attack, the melanocytes are lost. And as I said before, the melanocytes contain the pigment or the color of the skin. So, that is why when these cells are being attacked and damaged, they are lost, and that results in depigmented skin, and that causes vitiligo.
Mhm. Are there people who are at risk? I mean, with various, skin related infection or skin related conditions, we often see people whose immunity is compromised, or, who have a dry skin, etc., etc. They are more prone to have various other kinds of skin infections or allergy. But when we talk about vitiligo, are there any risk factors, doctor?
See, like vitiligo is not caused by any allergy as such. So, but there is a genetic component in vitiligo. There are few genes that predisposes to autoimmunity, and if these genes are present, your body normally does not attack the melanocytes. But when these genes are present, when they are combined with certain environmental triggers and stressors, they start to stimulate these autoantibodies and they go and attack these cells. So yes, there is a family history or genetics involved. So that is one of the predisposing factor. And also in certain people who already have vitiligo, trauma itself may increase and cause the spread of the lesions. So So that is a risk factor. Again, there are few chemicals that may cause depigmentation of skin or the appearance of white patches, but we need to differentiate them because vitiligo is a condition in which there is an immune-mediated attack on the melanocytes. Whereas there are few other skin conditions in which there is pigmentation loss, but it is not due to immunity.
Right. And Dr. Vignesh, we will also like to understand once again from you that how does it looks like? I mean, people many times what happens, we spot very tiny spot on our skin and we ignore it, feeling that it is nothing, but then it gradually grows. So, to for better understanding as a layman, if you I want to know how does vitiligo looks like.
Yes, vitiligo is basically white patches that appear on the skin. So we have to know that vitiligo is something that is acquired or something that occurs as the person grows. It's not something that is usually present at birth. So usually it presents as these white patches, which are usually well marked, and they may increase in size or they may stay the same for a period of time. So there are different presentations of vitiligo. So it may involve any sites. They may involve your face, they may involve your hands. Sometimes they even involve your genital mucosa. Sometimes vitiligo may be associated with whitening of hair as well. So this is called leukotrichia. So that is because these melanocytes are not only present in the skin, but they are also present in hair. So in those cases, there may be whitening of hair as well. So again, talking about the various patterns of vitiligo, you can have vitiligo that is limited to a small patch, or you can have vitiligo that is involving nearly the entire body surface area. So there are different presentations of the vitiligo, but we have to differentiate it from other conditions, such as leprosy and certain fungal infections. These also you can have patches of skin that are light in color, but the difference is they will not be chalky white like in vitiligo, whereas they will be more paler in color. So in order to differentiate this, so we have a few instruments like dermoscopy and Woods lamp examination that can help guide us to the diagnosis.
Okay, fair enough. So, when a patient comes to you with vitiligo, as you said, I mean, many a times, just not to confuse it with other skin conditions, there are, tests or there are procedures. But in general, when a patient comes to you, is it just the clinical investigation that you do, or normally also you recommend various tests, etc., for proper diagnosis, doctor?
So normally vitiligo is a clinical diagnosis. So when we get the history of these white patches that appear and are progressing in nature, and when we do an examination, we see these chalky white patches that are having an almost rounded border. So we think of vitiligo as a diagnosis. So we may sometimes do a dermoscopic examination or a Woods lamp examination. So these are special instruments that we dermatologists have that gives us a 3D image of the skin. So what a dermoscope does is it allows us to look deeper within the skin and we can see whether there is a damage or loss of these melanocytes. Also, when we do an examination, we look to see if there are any markers of disease activity because the vitiligo may be stable or it may be active and progressing. So when we do an examination, we see these small dots that are next to this main patch. So it gives us an idea that the vitiligo is active. Also, we look for the presence of different colors that are present in the vitiligo. For example, if we look at the border of a vitiligo patch, and we see that there are 3 to 4 colors, like white is there, then light brown is there, dark brown is there. So that gives us an idea that the vitiligo is spreading to the normal surrounding skin. So that is also something we look for in examination. So, in addition, we also take history of certain autoimmune conditions. As I said, vitiligo is an autoimmune disease. So, there is a high possibility that there are other autoimmune diseases also, like thyroid disease or diabetes. So, we may take history to see if the patient has these conditions as well. And investigations, when we do them, maybe to see if these other autoimmune conditions are also there in the patients. Very rarely do we do a skin biopsy when we have a doubt in the diagnosis and we want to confirm it. So in that, we see that there is a loss of the melanocytes when we do a skin biopsy.
Okay. Doctor, are there any symptoms of vitiligo, or it's just the signs that we can see as a layman and then go and approach a doctor?
Right. So vitiligo is a depigmenting disease. Usually there is no symptoms like there is no itching or there is no irritation. Usually when itching or irritation is there, it may point us to a different diagnosis. For example, fungal infections. They may also present with light patches and there's going to be itching and there's going to be scaling. Sometimes some people apply few chemicals on their skin and there may be irritation and there may be scaling. So, but vitiligo per se will not have these symptoms. So, vitiligo usually just presents as a depigmented patch of skin. However, patients may have certain symptoms of the psychological effects of vitiligo. For example, they may be depressed or they may have a low self esteem. So, these are the other symptoms that people with vitiligo may have. And because of this, at times they may have sleep disturbance and they may not be socially functioning well.
Right. And many times, what happens, doctor, for example, there is a trauma on the skin, due to an injury, an accident, whatever. And in the process of healing, many times we see a white patch, and that patch remains for a longer time. Are there chances that a skin trauma, an injury, they can also lead to vitiligo?
Yes, so like skin trauma is something that is going to damage the skin layers and it's going to expose these melanocytes to the immune system. So, in a patient with vitiligo and with a predisposition, this trauma might actually cause the spread of vitiligo. It's something called Koebner's phenomenon. However, it must be differentiated from other conditions in which we get a white patch after the trauma. So sometimes the scars themselves heal with a lighter color than the normal skin. So, but then if you look at it carefully, we can see that it is just a light color, whereas it is not chalky white as we see in vitiligo. So yes, trauma can cause the spread of vitiligo in patients in where the disease is active, and sometimes trauma can produce scars that look like vitiligo but is not exactly vitiligo.
Okay. There are so many myths associated with vitiligo. We would like you to tell us something about them and what are the various myths and that they are myths and not facts. For example, one thing that I know is that, don't have milk after consuming fish or, non-veg meat, say. It will lead to vitiligo. So there are so many myths, and I'm sure you also get to hear a lot about it. If you can shed some more light about those myths and facts.
Yes, see, vitiligo is an autoimmune disease in which the attack is against the melanocyte. It has nothing to do with the food that you consume or the combination of food that you consume. So, either eating citrus fruits or milk or eating fish and milk does not produce vitiligo. In fact, you should take a nutritious diet so that your immunity is in control and is well regulated. Also, there are certain other myths that vitiligo can spread from one person to one person if we just look at the person
Right.
with vitiligo or touch them. So this is a big myth because it is an autoimmune disease and it is not an infectious or a contagious disease, and it does not spread from one person to another. So another myth is that once vitiligo is there, it cannot be cured. So well, the thing is vitiligo can be treated and we can reduce the depigmentation and can bring color back into the depigmented skin. And there is definitely a treatment available for vitiligo, but one has to be patient and take the prescribed treatment for the prescribed amount of time. Also, another myth that is associated with vitiligo is that it is caused due to some sins in the previous life or something like that. Whereas that is not true, and it is just another autoimmune condition. Just like people have diabetes or sugar or BP, something like that. You can also have diabetes. Another myth that people have is that if the people are having vitiligo, their children will definitely get vitiligo. Well, that is not the case because the pattern of inheritance and transmission of vitiligo is quite complex. In fact, only 20 to 30% of the patients with vitiligo have a family history of vitiligo. So it does not mean that if the parents are having vitiligo, the child will definitely have vitiligo because it is caused by a complex interplay of factors, not only genes but also the environment, diet, and other conditions also.
Right. And doctor, still, if the parents are a patient of vitiligo and they are planning to, increase their family, is there anything that they should do just in case? Because, of course, that is a factor, right? Genetics plays a role if not in all the cases, but that risk is there. So, is there anything that they can do?
See, the risk of the genetic factor, like I said, is 20 to 30%. So when I say
Hmm.
genetic factors, suppose that a combination of genes, like if ABCD is present, it produces vitiligo. Sometimes it may so happen that the parent has AB and XY, and the other parent has CD and FG. So it does not mean that when they have a child, they are going to have ABCD all the time. So this is a random, assortment of genes that happen. So it does not always mean that ABCD will definitely occur in the child. So another thing is, like I said, there are few other non-genetic factors that can modify the genes, such as reducing the amount of stress, reducing the amount of oxidative damage, taking antioxidants. What this does is it masks the genes that are present. So even if the genes for vitiligo are present, they can be covered by taking these measures like taking antioxidants, avoiding stress, and they may not express in the child. So these are few things that can be done and that can be controlled. However, if even if we do take this, if the vitiligo does occur, it can definitely be treated, and there are a number of effective options and treatment and newer options that are available.
Fair enough. As you mentioned, treatment options, now we would like to understand what are the various treatment options available for vitiligo and how much can be treated.
So the treatment options will depend on the type of vitiligo. So if it is a non-segmental vitiligo, that means that the vitiligo is affecting patches of your body in a non-symmetrical manner. Like one patch is there on your hand, the other patch is there on your leg. It's not restricted to one side. So it means a non-segmental vitiligo. So next we have to see whether it's increasing or it is a stable. Increasing vitiligo means the patch numbers are increasing, or the vitiligo patch size is increasing, or you are getting new patches where you have trauma or injury. So these are all signs that the disease is active. So that means there is ongoing autoimmunity in the body. So our treatments in this case will be to stop this autoimmune process from progressing. So that can be done either with the help of oral medications like oral corticosteroids or oral methotrexate, azathioprine. There are a number of molecules like tofacitinib is also there. So what these go and do is they are going to stop this autoimmune process. So number of creams can also achieve this, but creams we usually give when the vitiligo is limited in area. So we can give topical corticosteroids, topical calcineurin emitters. There's a new FDA-approved molecule called ruxolitinib, which is a JAK inhibitor, which goes and acts on this autoimmunity and it's going to stop it. So that is one arm of it. So once we stop the autoimmunity, the next step is to bring back the color in the patch that has already lost its color. So that can be done with a number of other treatment modalities like phototherapy. Also, there are a number of lasers available that can help to bring back the color in the depigmented skin. An example would be the JIPMER laser, which works on the UV radiation, UVB light. Okay, so that is as far as the non-segmental vitiligo is concerned. Segmental vitiligo means that the vitiligo is restricted to one segment of the body. Like either it's there on one side of the face or it's present on the one arm. So usually this is present in childhood and it does not change in size or the number of patches as the person gets older. So it usually remains the same. So in these cases, the chances of achieving pigmentation with medical therapy alone is very less. So in these patients, they would be better suited for surgical methods of correction. So there are a number of different surgeries available. So basic principle of this surgery is we take cells or the tissue in which the color is present from a different area of the body and put it into the white patch so that the white patch can have the pigment. So those are the surgical methods of treatment. So the white hair can also be treated in vitiligo. So like I said, the medical modalities can help. And also there are surgical modalities also for bringing back the black hair. For example, if we take black hair and we put it into a patch of vitiligo, it has been seen that the color spreads from the hair into the white patch. So these are different treatment options available for vitiligo.
Okay, so the bottom line is that in case you have these signs, please go and consult a qualified dermatologist for early relief. Thank you so very much for that answer, doctor. And there are few viewers who have asked similar questions. I mean, related with treatment part. I'll take them one by one. So there is Palkesh, and his question is: can vitiligo be treated with herbal medicine? And to add to it, we are so obsessed in our society with home remedies, DIYs, other therapies that we first try everything before we go and land up in front of a doctor. And I'm sure you have seen patients who have, wasted years and years in treating it by themselves, and after nothing works out, they come and land in front of you. So, what's your take on this?
Yes, ma'am. So, like herbal medicines for vitiligo, there have been herbal medications for treating vitiligo from the ancient times. So, if you take ancient Egypt, for example, they used something called ammi. So, that is basically a plant. So, basically, when they rub it on the vitiligo patch, it causes blisters. And because there is blistering, there is actually removal of the entire skin, and there is regeneration of the skin from the surrounding, surrounding areas. So that they felt was repigmenting the disease, but that is not a very effective way, or you need not suffer so many side effects in order to get back the pigment. So now there are a number of newer molecules that are available that can help to achieve your target in a safer manner and can give better results. So herbal medicines, even though there are not much studies, and they are not how do I say, they are not very much standardized to produce the results. So you do not know whether it will work for you, and you do not know how it will work for you, and what are the side effects it may have in you. Whereas there are other treatments, like I said, that have a lot of scientific evidence and backing, and lot of experience is done with the use of these molecules that work better. And like I said, vitiligo is a disease that may spread with trauma. So in case you apply some wrong product or something, it may spread even further. Also, you are wasting time by using these products, which may harm you more than help you. So it's better to consult a dermatologist early, so that we can diagnose this and treat it before it spreads too far, and we can achieve a good result.
Right. There is one more question by Ankit, and his question is it possible to reverse vitiligo completely?
See, vitiligo is an autoimmune condition. Just think of diabetes or sugar. So there are medicines available that can help to completely control it. But cure for diabetes or sugar is basically patches, which can be applied on the patches to treat it. However, complete cure is difficult to cure the disease completely with medicine. So some medicines like steroids or follow a specific treatment regimen, may not have a complete cure, but they can or get better. So there are options available, but
Okay, Pooja is here. Her question is: can vitiligo be linked to diabetes? I'm sure she is asking about the risk factor. Does diabetes increase the risk of vitiligo?
see, like diabetes is also an autoimmune condition. So in this, what happens is the autoimmune body will go and attack the pancreas as continuously, because of the so autoimmune diseases. So we have seen that also at the time we have diabetes. So both of them can coexist at the same time. Because both of them are caused by the disease. However, one does not need to have both of them at the same time.
So, we are talking about vitiligo and what are the various myths and facts associated with it. A very common question patients also ask is that does stress cause vitiligo, doctor?
So stress does not directly cause vitiligo. So, but what stress can do is it can enhance the genes that are present for vitiligo. Suppose you have the genes for vitiligo now. What stress can do is it can convert those genes into vitiligo. So this is what happens, because what happens is of oxidative stress in your body also might increase. So that may also lead to progression of vitiligo. So directly stress may not cause vitiligo, but it can cause it to get worse. Yeah.
Okay. And one more question by Mohit. Can vitiligo cause hearing problems? Is there any association, doctor?
Sorry. So, however,
So we are talking about vitiligo, and we are getting a number of questions by our viewers, and we are trying to seek answers to them from our guest of today's discussion, Dr. Vignesh Narayan R. And we are trying to understand that what is vitiligo, how it affects us, and it's just not a skin-related issue. It is definitely, but then deep down, it do affects our self-esteem. Many times people go into depression. And there is a similar question, Dr. Vignesh, by one of our viewer, Amit, who's asking that do people with vitiligo face challenges in finding a job? Because I'm sure you have treated people with vitiligo, you have faced them, listened to their problems, otherwise also. So, what kind of mental state are those patients in, and how do consultation also is an important part of treatment?
yes, ma'am. So vitiligo is associated with a lot of stress. So because of the depigmented patches and the stigma that is associated. So more than the disease is what the people think the patient has. So that causes a lot of mental strain to the patient, especially if it's on the exposed areas like the face or the hands. So patients try a lot to cover it. They usually wear gloves or long sleeve clothes just so that no one notices the patches. So that can be very taxing on them. So what that does is it causes stress. And like I said, stress even though not directly causes vitiligo, it can make it worse. So it's very important to be empathetic with patients with vitiligo. So they are just like human beings. So they are not very different, or and they are just as capable and just as good as you and me. So no need to look at it as a disease. You can think of it like just like we have different skin colors. So you can think of it also as a skin disease.
Okay, doctor, there is also a term called depigmentation. You have also used it during our conversation. Now, depigmentation and vitiligo, are they the same or are they different?
Loss of pigment. So that may be either due to vitiligo or it may be due to other causes like chemicals or burns or something. So it's a general term. Depigmentation just means there is loss of the color. So when this loss of color occurs due to autoimmunity, like I said, where the immune system goes and attacks the melanocytes, then it's called as vitiligo. Otherwise, depigmentation is just a general term.
Okay. Will vitiligo patches spread over time, or will they get larger in size?
So yeah, so there are different types of vitiligo, and like I said, vitiligo may be either active or stable. So when vitiligo is active, that means there is autoimmunity going on in the body. So because of this autoimmunity, it may increase in size. The number of patches may increase, and also you may get patches when you get trauma or you get injury. Also, the hair may also turn white. Whereas sometimes, like in stable vitiligo, the patch remains stable and does not increase in size; it remains the same. Sometimes the vitiligo may enlarge to involve the entire body, in which it's called universal vitiligo.
Right. Now, doctor, when a person comes to you soon after, spotting few spots on the body, white spots or depigmented patches, And say there is another case where a person has already tried a lot, done a lot of DIYs, home remedies, tried almost everything, and then came to you after a couple of years. Do there, in both the cases, the treatment duration, does it vary?
So usually, like when the patients have already tried a lot of treatments by themselves, they are not compliant with whatever treatment advice is given. So that usually affects how the treatment response is. So, but if the disease is active, so we really need to hit hard with treatment that can bring back the color. So once the scar is done, we can give treatments that can bring back the color. So many a times what happens is patients, they try these home remedies for a long period of time. The vitiligo keeps progressing because it's not addressing the root cause.
Hmm. Right. Because you have seen a lot of patients, Dr. Vignesh, and many a times, as a doctor, I'm sure there are cases where you think that probably they should not have committed this mistake before coming to us, or maybe they would have come earlier, that way the treatment would have shown better results by now. So, are there any things that you normally think in the case of vitiligo when you treat vitiligo that please don't do this, don't do that, in case you have vitiligo? Are there any things like that? Do's and don'ts?
Yeah, do's and don'ts. Basically, you need to follow whatever the treatment regimen is prescribed, and for the adequate duration of time. So what people generally do is they start some treatment and then they leave it in between because they are very impatient and they want results immediately. So follow the treatment that is suggested for an adequate amount of time. So what you should not do is sometimes you use these herbal products that can damage your skin and cause scarring. So once the scar is there, the getting pigment back in it is difficult, and we may need different modalities to get the color. So what you can do is you can eat a healthy diet. You can reduce the amount of stress that is there, and another thing is accept the fact that this is not a disease that is conquering you. It's something that you can conquer. So that will go a long way in treating this disease.
Right. A very common practice that we normally do is to, for example, I'm a patient and you have given me, say, 2 months of medication. I'll religiously follow that prescription for, say, 20 days, 25 days. And because I have seen some, improvement in my condition, I'll stop taking the medication without even keeping the doctor in loop. I won't even inform the doctor. Again, if I see that again my lesions or the demarcation is getting growing in size, etc., then because I have the prescription, I'll go get the medicine started all over again. It's a very common thing that we normally do with almost all kind of treatments. Do you get patients who do like this, and what's your advice on that?
Yeah, so I would say that vitiligo is a chronic condition. So this is an ongoing process that has been there in your body, and it needs time to control the disease. Also, it takes time for the color to come back because the cells have to regenerate, and once they regenerate, they have to start producing the pigment. So it's a long process, and discontinuing the treatment in between can reverse most of what we have achieved so far. So it's very important to stay consistent to whatever treatment regimen is given and the treatment regimen. And remember, it's a fight that can't be conquered, but it can be fought.
Doctor, normally, we know that a healthy lifestyle, good eating, good diet, good sleep pattern, physical exercise, they all go a long way in maintaining good health. Even in many skin conditions, we have seen that, what to eat, what not to eat, how much you need as beauty, sleep, etc. They work wonderfully. Now, in case of vitiligo, any lifestyle modification, anything that you would like to tell us?
Yeah, so lifestyle modification is mainly aimed at reducing the amount of oxidative stress that is there. So you can do that by reducing the amount of fried and fatty food that you eat. You can reduce the amount of caffeine and refined sugar that you take in your body. So to increase the level of antioxidants, you can take a healthy multivitamin of fish and nuts, and you can do a regular moderate amount of exercise. for 1 week. So what that will do is it will help you tackle the stress, and it will also reduce the amount of reactive oxidant species that are present, and will keep the vitiligo under control. Another helpful thing that is suggested is, sunlight is something that's a double-edged sword. So sunlight can make the surrounding skin appear darker, and it can make the vitiligo patches to be more prominent. However, the sunlight may help in repigmentation of the vitiligo patches as well. So what is recommended is you get around 10 to 15 minutes of sunlight exposure every day. And so what that will do is it is going to bring back the color in your vitiligo patches. So, and you can do this every day so that the color starts coming back.
Okay. And doctor, before we sum up the whole session, any take-home message for our viewers?
So the take-home message is vitiligo is a condition with these depigmented patches. So it is usually acquired, not present at birth, and it needs to be differentiated from other patches of white skin like fungus, or it can be due to other infections also. So once we know that it's vitiligo, you need not worry because it is not contagious. It can be treated, and number of treatment options are available. Also, it may not always pass on to the next generation, so no need to worry about it. So, what is important is not to waste time with self medications, but to consult a dermatologist so that it can be diagnosed and appropriate treatment can be started.
Right. So do not suffer in silence. Do not hesitate to come up and talk about it and seek proper treatment and advice from a qualified dermat. So, in case you have these spots, please go and consult a doctor. And it's a condition, you'll get relief. Of course, there are treatment options, but the important part remains don't self medicate. Go to the right person, which is a qualified dermat in this case. Thank you so very much, Dr. Vignesh Narayan R. It was
Thank you.
wonderful talking to you. Thank you for your valuable time, and it has been a very informative session for our viewers. It was great hearing you. Thank you once again.
Thank you for the wonderful opportunity.
Thank you, Doctor. And this was issued in public interest by makers of Lulibor Lotion Advanced Genex Division of Hetero Healthcare. And viewers, thank you for your active participation in today's session. Stay connected to our channel. Do not forget to subscribe and our channel Radiance with you. Thank you and have a great day ahead. Goodbye.